Hey guys, it's Dr. Brandie with another episode of Pregnancy Pain Sucks. I have a new guest today. This is Mabel. Mabel is a new addition to our household, and she's in should we say she's a French bulldog like Beef is, and she's a baby. And she was very quiet and sweet, and she's entered the I'm going to bite everything in its place. But she's been a lot of fun, and you'll be seeing her a lot more. But this is her. We originally chose her. We didn't intend to get a puppy, but my new husband's brother breeds French bulldogs and sent us a picture. We were at breakfast, and there's a pile of 6 puppies all in this big pup pile, and we saw her off by herself. She was on her back with her little chubby belly. I am Pibble. Laying off to the side. So we had to have her, and as both of us are Gen X, love Goonies, so we were calling her Chunk, which is not a nice name, but we settled on Mabel for her formal name because I wanted something sort of sweet and old, but this is Mabel. She's very sweet. Speaking of that, since filming, I did get married for New Year's Eve, as you guys saw on my social media. It was absolutely perfect. The weather was a little chilly, but just like the sunset behind me in Camogli, which was one of the places I aspire to retire to, it just was like literally that color. And then my dress I got from TikTok, which is crazy, and I really loved it. And it just was perfect. It was perfect. It was just us. It was no stress. It was no drama. It was just beautiful and simple and loving and just totally fit my life. So yes, I just got married, and the next day after coming back, picked up a puppy. So I'm a glutton for punishment with that type of stuff of just changing stuff rapidly. But in talking about that, today we're going to be talking about your body changing rapidly. And a lot of discussions I had today at practice when I was seeing patients, I'm going back this afternoon, was centered around not understanding why the second pregnancy sucks so bad. Or concomitantly, I had a patient today. She's so athletic. She's a badass. She plays a 3-5 tennis level, but she was out playing tennis today and fully playing tennis at in her 3rd trimester, which is awesome. And she's like, I just don't understand. I was able to do all this stuff before. And I said, you have a different thing that 1 year older, unfortunately. And 2, you have 2 weightlifting babies that you're holding when you're at home that you didn't have to deal with the first time. The other thing that I talked to another patient was not understanding the concept that in this country, we really don't do a good job of rehabbing stuff. So I want to get into that. So when I was talking to the patient today, we were talking about she came back for her post-pregnancy exam, and she's like, I don't know how anybody would get pregnant back to back. My kids are 22 months apart, and it was hell for me the second one. I don't understand why it was so bad. The first one, I didn't really have these problems. The second pregnancy, I really was on the struggle bus. But she said, would it have made any difference if I put some more time in between? And I was like, honestly, no. And that may not sound like it's accurate information. I could go either way. But what my thinking is, what my experience is of over 24 years, and I'm going to get Mabel from stopping this tissue up. If you can picture the Titanic, right? We all know Jack and Rose. If you can picture the Titanic, and right now, if you were taking some trip under the sea, and were able to visit the site of the Titanic crash, when you would go down there, everything is still there, right? And when I see women in their 4th trimester, I think that they expect that with time, such as the Titanic, everything's going to dissolve and disappear, and it's going to be like it never happened. And while there was a lot on the Titanic that disintegrated, dissolved, I don't want to get into the gross stuff, but even simply the food, if you can just even picture the food on the Titanic, that disintegrated and went away, right? All the perishable stuff has long gone. Fish have eaten it. So all of that stuff is not there anymore. But at the same time, the stuff that was in there that really was heavier, such as furniture or stuff that's made out of different materials, that's still in there. So to expect that all of that would go away, the only way that would go away is to extricate it, to clean it out. And in this country, as I said, a lot of women are not aware of pelvic floor therapy, which is internal therapy that they can have done with the ligaments and muscles and tendons in their undercarriage that are vastly stretched out, and pelvis is misaligned from those being out of place. The body really accommodates for pregnancy, but as I've mentioned a million times, if you're sedentary or you have injuries that you don't really rehab because you either don't seek care with a body worker who is familiar with pregnancy, all of that stuff, all of that debris is still trapped inside, just like with the Titanic. So what can you do? Or like if you're planning on having another baby, or even if you're not planning on having another baby, I see so much with the fourth trimester. I can't tell you the number of women that are my age or really in their 50s, and I'm in my 50s, it just hit me, I'm 52, but like women in their 60s, say. Or the other thing that I'm seeing a lot of, which is this really interesting demographic thing that I would have never imagined, is a lot of the women that I took care of during their pregnancies are now getting divorced and are coming back and having vibrant sex lives, which is so exciting to hear about. But they're having sex injuries, which cracks me up because it's a totally different vibe, walking them through the sweet, beautiful pregnancy and then hearing about how they're dating this guy named Kevin, and they really want to tell me about all the vibrant things that are happening. And I'm so down for it, as long as the guy treats them well. But just to see them come alive with a new awareness of what's going on with their body and how to use their body and how to feel things in their body and how to feel things in their body. I'm so down for that, to help them fix those things. And a lot of the things that they're experiencing, such as pubic pain or lower back pain or hip flexor issues, are coming back. And they're like, I don't understand. I haven't felt this since my pregnancy, because it's still all there. So if you could understand my analogy with the Titanic, yes, some of the stuff will go away, but without a professional excavation of the stuff that's not going away, it's still there. So say you come in for me and you're in your 60s and now your groin hurts because you're dating again. Sorry to be so graphic, but this is what's happening. And I start palpating your groin. A lot of that stuff is still in there. So when I push down, there's residual trash that was left behind from your body trying to brace everything. And yes, it was dormant. It stopped hurting, but that doesn't mean that it has gone away. It's still just like the Titanic, under the sea. You'd never know. But if you actually go down there and start digging around, that's where it is. So if you really want to rehab well in your fourth trimester, if you're planning on having a better pregnancy this time, the big thing that I see a lot of prep, of body working prep, is for a VBAC, of getting your body repaired, aligned, flexible enough to accommodate, especially if the baby was so big or you had a malposition of your pelvis. There's a lot you can do. So a lot of the stuff that I deal with in my courses, I now have a subscription if you're more interested in that instead of buying a particular course. Anything to do with the injuries around pregnancy or anything to do with the symptoms that you're having, the residual problems, there's now a section on there for fourth trimester, because it's so critically important to understand that, yeah, it feels like when you were pregnant, and that is because the damage was caused by your pregnancy that you never treated. And now you're doing new things that I love hearing about. So down for this part of my life. I just got divorced, as we know, a couple of years ago, and completely reinvented myself, completely different life. I am so much more relaxed and chill and fun. I never had fun before. But it's so cool to see these women reinventing themselves. Like with Bloom, as I said, it was so sweet and cute and nice that they're having this baby and they're pregnant. But to see them awaken and bloom into a different chapter is equally chef's kiss about the whole thing. I love my job. I love my career. I love that I'm able to share those experiences with them. And it's one of the things they don't tell you about in chiropractic school that are just amazing to witness. And I just love watching any kind of transition where somebody changes profoundly and they're so different and better from it, and to watch the progression as it's difficult. So that's what I wanted to talk to you about today, about why second, third pregnancies are a little more challenging in terms of the physical damage that's left behind that a lot of people erroneously think, as I said, that just poof goes away. It doesn't poof go away. Just like, again, if you were an athlete in high school, had some chronic injuries, decide to get back into an exercise program, the trash is still there. The damage is still there. You really need to properly rehab areas. And you can do that with a chiropractor who's trained in this sector with fourth trimester, predictable things. You can do this with a pelvic floor physical therapist, occupational therapist. There's so many people that specialize in pregnancy and the damage that's done by our beautiful babies. But I hope you learned something new about that, about why that's happening. In the next podcast, I'm going to talk about the basic reasons of why this would be a problem. But I hope you learned something today. I hope I changed your perspective of why you're having issues during your pregnancy that you didn't have before. So tune in for that episode. I'm going to be going a little more deeper into that. But this is Dr. Brandie. Pregnancy Pain Sucks. Again, check out my website because I have a lot of assets for you about the fourth trimester. And I do have that new subscription model that's more a la carte or cafeteria style. Instead of sitting through a course, I allow you into a pantry of information that you can go in there, pick what you need, use it as you evolve. If you're pregnant, you can use it as you develop new symptoms and why you have new symptoms. I think it's extremely helpful. But I hope you enjoyed meeting Mabel. I had to pick her up off the floor because she's eating everything in sight. But as I said, this is 2026. I am so excited to share more information with you guys and empower you with information that you can use to have the best pregnancy ever. Dr. Brandie, Pregnancy Pain Sucks. Mabel and I say goodbye.